Today I'm going to talk to you about positional vertigo. Positional vertigo is one of the most common forms of dizziness that a person can suffer from. It is a pretty basic treatment, but it's very effective, and typically we can cure a person's dizziness within a few visits. I really haven't had anyone have more than 5 treatments before the positional vertigo has been cured. I myself had positional vertigo after hanging frames in the front of our office when we moved here a few years ago, and it came on very suddenly. It was a horrible feeling, so I know exactly what my patients are suffering from when they come in with positional vertigo as a diagnosis. I was able to treat myself luckily, and within 2 days I really was free of symptoms. So my goal here is to educate the patient as to what is happening to them, why it's occurring, and how we can get rid of it as quickly as possible. I'm going to go through the exercise of how we treat a person with the positional vertigo with my subject here. So I'm going to have him sit as I would any other patient going through this treatment. You're going to bring your legs straight out in front of you. Don't lie down. You're going to stay sitting up. Okay, and now you're going to scoot back a little bit on the table. Good, and come over a little bit closer to me so you're on the edge. Okay. Basically what happens with someone with positional vertigo is within the inner ear, the series of canals that we have located in there, there are what we call crystals, and they get displaced into the posterior canal of the inner ear. And when they are lying in there, that is what brings on the dizziness when a person changes position or moves their head or looks down or up rather quickly. It's typically a quick onset of dizziness, and it quickly resolves itself. So it's, it comes in spurts throughout the day depending on what the patient does and the movement that the patient does. So the goal of our therapy session is to put him through the series of movements to get the crystals that are in the posterior canal of the inner ear to move towards the anterior canal. And once that is achieved, the person's positional vertigo will be decreased and eventually it will fully go away. So I'm just going to demonstrate what I would do with a patient who does have this particular diagnosis. So basically what I would do is I have the person turn their head, and I'm going to hold on to his head. And what you're going to do, Amit, is just look directly at my nose and keep your eyes focused, okay? And then I'm going to quickly lie you down, okay? So on 3. 1, 2, 3. Good. And you're going to relax. And again, just look at my nose. I'm going to be staring at your eyes to see if there's any movement in the eyes. Now, if there's movement of the eyes or nystagmus, we have a positive test, and then we know that that patient truly does have positional vertigo. So after I evaluate this test, if someone does have nystagmus, we will go right into the form of treatment. Sometimes it takes up to 30 seconds for the person's eyes or the nystagmus to begin. And typically within a minute, the dizziness that the patient is feeling will be resolved. Patients are usually fearful of moving down to this position because they know that this is what brings on their dizziness. So if we were going into the treatment from this point, what I would do is turn the head, and I would hold on to it, and then we would stay in this position for approximately a minute, and the whole time I'm supporting the patient, they're just relaxing. And then from this position, we're going to roll onto our side. So on 3, what we're going to do is roll onto your left side, and you're going to look down towards the floor, towards my shoe, okay? Okay, on 3. 1, 2, 3. Okay. And once we do this maneuver, sometimes patients do feel dizziness again, because at this point, we're moving the crystals out of that posterior canal into the anterior canal. Once we hold him here for about a minute, then we're going to work on sitting up. So don't move your head, Omid. I'm going to move my hands, okay? Okay. And then on 3, what you're going to do is bring your legs off the edge of the table, and I'm going to help you to sit up. Okay? So slide your legs forward, and we're going to sit up. 1, 2, 3. Good. And at this point, I'm going to also take a look at his eyes and see if there's any more nystagmus occurring there. And that's a basic treatment. There are also sometimes home exercises that are given to the patient so that they can work on getting rid of the dizziness at home. And hopefully it's only a series of a couple of times that we see a patient with this condition, and then they're fine. Sometimes positional vertigo can reoccur. I have had patients that get it a month later. Sometimes they get it a couple of years later because they either had a traumatic event or they started doing a certain position, like what happened to myself, for 2 hours at a time, hanging photos up on a wall and looking up towards the ceiling. So sometimes it does reoccur, but as long as a patient knows that there's help out there and they could see a PT who can correct it for them, that's a very good thing for someone who's dealing with this condition.